Chair, members of conference, before I say anything else, I want to say thank you. Thank you to the countless GPs, nurses, healthcare assistants, practice managers, receptionists, office staff, cleaners, pharmacists and physios, paramedics, social prescribers, support staff, those in training and those who return from retirement, those working long hours and hard days, and those working at weekends and through the night. And not forgetting the increasing numbers who are at home because of self-isolation, but who are still working hard to support their colleagues and care for their patients. Thanks to LMCs up and down the country who have been there for their GPs and practices, providing support, help and guidance throughout this dreadful year. Thank you to all those in general practice and primary care who have worked tirelessly and with huge commitment and dedication throughout this year, a year like no other. Throughout the whole of the COVID-19 pandemic, from day one to today, general practice has been open for business. Indeed, as our own tracker surveys and numerous LMC surveys have shown, we've gone well beyond the extra mile for our patients and our communities. And as for NHS England, earlier this year, briefing the press to suggest otherwise, and to threaten sanctions on practices was simply a disgrace, and just undermined the morale of thousands of hard-working healthcare workers. Practices have done and are doing exactly the right thing by triaging all initial patient contacts and then only seeing those patients who need a face-to-face consultation or a procedure when it's clinically necessary to do so. By doing so, we are playing our part in protecting both patients as well as the workforce from overcrowded waiting rooms and the risk of spreading this deadly infection. And so we should be commended, not condemned, for doing so. We now know the reality of what this infection can do. We've all been shocked and saddened by the loss of respected colleagues and friends, and we grieve deeply for them. All that we do for the colleagues we represent and the patients we care for should honour them and their memory. Practices have had many dark days in the last few months. But despite all the difficulties, I'm proud by the way GPs and their teams have responded to this massive challenge. We have shown what GPs can do where there is reduced regulation, and we are trusted to lead. We radically changed our working arrangements within days, and digital solutions that were planned to be implemented over years were done within weeks. When problems arose, such as the scandalous problem with PPE, or lack of funding, or unnecessary bureaucracy, we vigorously addressed them. We secured thousands of laptops to enable GPs and other members of the practice team to work from home, if they were shielding or self-isolating, or just to free up space in office areas to enable more social distancing and safer working arrangements. We made important changes to the way fit notes can be issued and to the verification of death, changes that we need to learn from and take forward in the future as they help to reduce GP workload. And we also secured income protection for the rest of the year, for most of QOF, giving practices confidence to do the right thing for their patients without the worry about ticking boxes and targets. And when faced with the deeply concerning rise in the number of patients with COVID-19 in our care homes, practices responded and provided the support that was needed. We resisted regulatory change and instead demonstrated that GPs and their teams are dedicated professionals who will do the right thing for their patients. We stepped up at this time of national crisis. We responded with speed and effectiveness, but all too often government were behind the curve. Guidance was delayed, initiatives too limited, and funding too little. And after months of lobbying, when we did finally secure the essential COVID fund to cover the additional work done by practices, it only lasted until the 31st of July, as if the virus had suddenly left these shores by then. How wrong they were. and how apparent now is the need for proper and ongoing support. And so I'm pleased that after our pressure, we have secured a further £150 million to support additional capacity in practices, including paying for more GP time at this crucial time. When we last met, at one of the last major events before lockdown, the focus of our special conference was on the second year of our contract agreement. It seems like an age away, but the issues remain important. The fundamental problems have not gone away, and we still need investment in general practice, not least to support GPs and practices deal with the massive workload pressures they are experiencing. As we now know, we responded vigorously to the original proposals 10 months ago, and as a result secured significant improvements, with an expansion of the workforce to help support our workload pressures, a crucial agreement to 100% reimbursement, and many other changes besides. And as a result of the work we've done, now 99% of practices have signed up to be part of their PCN. And if the pandemic has done nothing else, it's demonstrated the benefit of working together across a community, with practices able to support one another in times of crisis and challenge. But we know all too well that there is still a lot to do and many issues to resolve, which is why we are committed to do all we can to tackle these issues and enable every practice to fully benefit from the investment made in their network. The pandemic is making recruitment difficult, but it's still important to try to do this if we are going to help deal with the workload burden we carry, and also to use our PCN workforce to support the COVID vaccination programme in the coming months. As the nation faces a time of potentially rising unemployment, and with all the health and social consequences that will bring for many people, we need to do all we can to use the guaranteed increased funding we have secured to expand our workforce so we are better placed to enable to respond to the growing needs of our patients and communities. Whilst having 26,000 allied healthcare professionals working alongside us will be welcome, we still need to recruit and retain more GPs and turn the year after year decline in GP numbers around, not least the fall in the number of GP partners. It's great that new partners are now getting the partnership premium payments of £20,000, as well as additional funding to support their training, with over 200 applications processed so far, with almost another 200 in train. It's also good that we're now seeing the benefits of an expansion in the number of GPs in training, as well as giving more time in general practice as part of their training. We now need to use the new fellowship scheme to provide better support to newly qualified GPs and train up experienced GPs as mentors to help their new colleagues. We've made inroads into providing more help with childcare costs and enhanced shared parental leave, but we need to do more. Removing the massive cost of indemnity for everyone, partner, salaried GPs, GP locum and other general practice staff, has not only saved many thousands of pounds every year, but it's also giving GPs confidence as they care for their patients. And this year we've also been able to cut the burden of appraisal for all GPs, with the new scheme radically reducing preparation time and the need to gather bulging files of evidence, and instead doing something much more useful in focusing on well-being and support. And after a huge effort, we've secured payment for the unjust and iniquitous annual allowance tax charge, together with pension changes to reduce the impact in future years. But pensions payments are dependent on the proper management of pension information. So the continued shambles created by PCSE, with countless numbers of GPs still experiencing unacceptable delays and mistakes in processing their pension information, is simply unacceptable. It's frankly a scandal that Capita have been allowed to get away so long with such a poor service, but we will not give up on challenging that. These are completely avoidable problems that practices can do without, particularly at this crucial time. Practices need to be freed up from unnecessary bureaucracy and hassle so they can do what they do best, that's care for their patients. All that we do depends on the hard work of many people. And I want to take this opportunity to thank my executive team, Mark, Farah and Krishna, the policy leads and chairs of the Sessional GP Committee and GP Trainees Committee with whom we work so closely, and the many BMA staff members who work with us 7 days a week with such dedication and expertise. Without them all, we would not be able to achieve as much as we have done this year. As the pandemic accelerates once again, we have a massive and crucial role ahead of us. As Sir Simon Stevens said just 3 weeks ago, we are doing very well thanks to the brilliant work of GPs in expanding the flu vaccination uptake this year. Health Minister Joe Churchill and more recently Matt Hancock were also right to thank and praise GPs and our teams. For when we face a challenge, we deliver. Now, with the daunting COVID vaccination programme facing us, there can be no better people to succeed in this task, which the whole nation is depending on. Whether we work in local groups or more regional centres, once a safe and effective vaccine is available, our practice teams will work to the best of our considerable ability to protect our patients as quickly and as practically as possible. And whilst we may have superpowers, we cannot be in two places at once. And so we will need the help of everyone. We'll need to be able to prioritise the rest of our workload, and crucially, we'll need the understanding of our patients in doing so. We will need all hands to the pump. GPC England will continue to do all we can to help and support practices respond at this critical time. We'll keep up the pressure on government to deliver on their promise to do whatever it takes to deal with this pandemic. We'll tackle long-standing bureaucracy, much of it needlessly created by government and NHS England. We'll push for further investment into IT systems to enable practices to build on the rapid changes they've made this year, making it completely unnecessary to expand the commissioning of digital-first providers. And we'll also work with our secondary care colleagues to deal with the completely unacceptable workload pressures being placed on practices because proper systems in the community have not been commissioned or funded. GPs have shown that if freed up from unnecessary burdens, even in the most challenging of times, we can be trusted to lead and we will then deliver. GPC will do everything we can to empower GPs to do just that. For by doing so, doctors and patients will benefit.